Welcome back. Today we're diving into an explainer based on a really fascinating podcast discussion. Two hosts recently broke down a document straight from the front lines of plastic surgery called the Anti-Age Manifesto. My goal today is to take their conversation and completely demystify the biological science of facial aging while exploring the rapidly evolving aesthetic interventions we have today. We're going to separate the marketing hype from the medical reality so you can clearly understand the true fork in the road to youth. Okay, let's dive right into this. We're going to start with the actual biology of aging, then we'll weigh Botox against surgical options, explore the sudden rise of prejuvenation, warn you about the pitfalls of aesthetic overkill, and finish up with the art of subtlety. Part 1. The biology of aging, the cellular reality of getting older. So as the podcasters discussed, why do we actually age? It's not just that tired feeling, and it's definitely not just skin deep. It's this literal, physical breakdown happening right down in our DNA. It's driven by tissue stem cell depletion, chronic inflammation, and cellular senescence, which is really just a scientific way of saying your cells simply get exhausted and stop dividing. To understand how to treat aging, we first have to look at the main biological culprit. The real engine of the aging process? Telomeres. Think of telomeres like those little plastic caps on the ends of your shoelaces, right? But for your chromosomes. They protect your DNA. But as we age and as we're exposed to things like oxidative stress, UV radiation from the sun, and environmental pollution, those protective caps just get whittled down. When telomeres get too short, the cell can't function properly anymore. That is literally what drives the aging process at a cellular level. So how does all that microscopic telomere action actually show up in the mirror? Well, you get a loss of volume. Basically, that underlying soft tissue support just kind of gives way. We start seeing more wrinkles and deep folds. The skin becomes progressively thinner, drier, and less elastic. And eventually, gravity definitely takes its toll, causing jowls from shifting fat and muscle, drooping, or what doctors call ptosis. It's all completely biologically connected. Moving on to section 2. Botox versus surgical options, the million-dollar question. Now that we've got the biology down, how do we actually intervene? Well, the hosts made a great point that it boils down to distinguishing between intrinsic and extrinsic aging. Intrinsic aging is chronological. It's the sagging, the excess skin, the gravitational folds. When things physically drop, you actually need surgical repositioning, like a facelift. But extrinsic aging? That's environmental. Sun damage, static wrinkles, aging spots. For that, you absolutely don't need a scalpel. You treat environmental aging with lasers, peels, fillers, and Botox. When targeting that extrinsic aging, surgeons map out super-specific injection sites for facial sculpting. They focus on key mimic muscles. For instance, right between the eyebrows, they target the corrugator and procerus muscles, which are the exact culprits behind those deep vertical frown lines. By hitting those precise spots, doctors selectively relax the muscle, completely smoothing out the skin right on top of it. All right, section 3, the rise of prejuvenation and the microbotox revolution. Enter microbotox. This is a total game changer. It's a chemoresurfacing technique where, instead of going deep into the muscle, doctors take highly diluted Botox and inject it super superficially, like just barely under the skin surface. The clinical goal here isn't to freeze your facial muscles at all. It's to improve your overall skin texture, dramatically shrink pore size, and control oil production by hitting the sebaceous glands. It's literally the medical secret behind that glassy skin aesthetic everyone is chasing. Let's compare them directly. Traditional Botox goes deep into the tissue to block dynamic wrinkles, which, let's be honest, definitely carries the risk of that dreaded frozen look if a doctor overtreats the area. But microbotox, because it's injected superficially to target those sebaceous glands, it completely avoids the deep muscle. The brilliant part is it perfectly preserves your natural facial expressions. You get the incredible skin refinement, but you can still, actually emote. Of course, practically speaking, there are some trade-offs to this newer approach. Since microbotox uses about 50% fewer units, the cost per individual session is a lot lower. But the duration of the effect is only about 2 months, compared to the 3 to 6 months you'd get from traditional Botox. Because it's right near the surface, your body clears it out much faster. So you're definitely looking at more frequent maintenance trips to keep that perfect texture. Section 4. The pitfalls of aesthetic overkill. The occupational hazards of perfection.
Look, every medical intervention has a dark side, right? And the biggest pitfalls usually start with completely unrealistic patient expectations, like hoping a physical procedure will magically fix a deeper emotional issue. Then there's the massive risk of choosing an inexperienced surgeon. Add in the danger of overcorrecting, which leads to obvious aesthetic overkill and unnatural asymmetry. And at the far end of the spectrum, this ties into body dysmorphic disorder, where patients become obsessively focused on microscopic perceived flaws. The psychological toll here is incredibly real. In their chat, the podcasters highlighted how the manifesto strictly warns us to beware of Daffy Duck lips and Picasso noses. I know, it sounds hilarious, but it's a genuine medical warning. It's what happens when doctors cave to bizarre patient requests or when patients keep demanding just a little more filler. You wind up with frozen foreheads and lips like a startled pufferfish. It is exactly the opposite of the youth and beauty they're actually paying for. And finally, Section 5, the art of subtlety. Finding the balance. Which brings us to the core thesis of the manifesto. The best aesthetic medicine should be practically invisible. When it's done right, the fringe benefits are amazing. You get a natural, youthful appearance. You achieve better facial symmetry without ever looking work done. The enhancements are age-appropriate, because as the authors jokingly warn, absolutely nobody wants to look like grannies and stilettos. The ultimate goal is maintaining your unique signature look. Successful aesthetics is about subtle self-enhancement, not erasing your identity. I absolutely love this quote from the source material. The difference between Beauty and the Beast is in millimeters. It's clever, but man, does it hit the nail on the head regarding the unforgiving precision this field requires. Just a tiny fraction too much filler, maybe 2 units too many of Botox, or a slightly over-aggressive scalpel, and bam, you instantly cross the line from refreshed to bizarrely overdone. Subtlety is absolutely everything here. So that leaves us with one big question. How are you going to navigate your own journey through the science of aging? Whether you decide to gracefully embrace every single wrinkle, opt for some subtle prejuvenation with micro-Botox, or eventually seek out targeted surgical options, understanding the actual biology and the genuine risks puts all the power right back in your hands. Thanks for hanging out with me for this explainer, and as always, keep learning.